Продовжуємо роботу.
We continue our working day at Ukraine Crisis Media Center. And now, presentation of the study life along the contact line, problems of the frontline settlements of Donetsk region. We give the floor to Galina Yanchenko, study director, NGO Foundation 101. So it works. Good afternoon. Thank you for attending this press briefing. We really thank you that you are interested in the issues concerning the Donetsk and Lugansk Oblast, because people in these oblasts, they believe that other people do not listen to them. So we want that the representatives of power and interested parties that they saw these problems in these small villages in gray area along the line of confrontation, and also to provide the opportunity to representatives of local community who have been living for 3 years under daily shelling, to provide them the opportunity to speak in order that their issues, their questions were voiced. I'm Galina Yanchenko, and I headed this survey we are going to present today. It is called Life Along the Contact Line, Problems of the Frontline Settlements of the Donetsk region. First, I would like to briefly speak about the methodology and methods of this survey. This was carried out during July-November 2017. We used quality methodology, in-depth interview. In the framework of this research, we carried out 45 in-depth interviews that lasted on average half hour. From half hour to 1 hour, these interviews were carried out with the representatives of local government, the heads of villages who are in the gray area, and also with the active residents, active members of communities, and with some peasants, some residents of these frontline villages. In the framework of our research, we studied 12 settlements that were grouped according to geographical principle. First, this was Bakhmut region. Second group, the villages in Volnovakha region. And third group of villages, they are in Mariupol region and partly in Volnovasky region. On the whole, the most pressing problems of these frontline villages, if we are speaking about them, about what is really pressing for people, so there are 7 main aspects, and the biggest problem is military action. These are mining and shelling and so people say about this negative situation, and official government, official media from Kiev, they say that in the Donetsk and Lugansk region there is an anti-terror operation, but the residents in the interviews, they didn't say about ATO. They call it, they say that there is war in the region. So this is the main problem. The war is the main problem there. If we are speaking about problems of the lower level, there are 6 more issues. What are they? First, access to health care, ambulance. We understand that in these remote regions, it is difficult to get access to ambulance throughout Ukraine, but here in this zone where people suffer more, where they can be injured by some fragments. This is an issue that is really the issue of their survival. Second problem is lack of qualified personnel. And this is in the sphere of healthcare and education. And also, our respondents said that there is lack of professionals and they cannot restore their settlements or to get humanitarian aid in full scope because the heads of communal and other enterprises are not able to organize process properly. And some examples were provided that humanitarian organizations provide construction materials, but they are not used by separate heads of institutions because they do not have proper personnel to carry out these activities. Next problem is roads, bad state of roads, and bad transport connection. And many cities and towns that are close to these villages, they are from the other side of the contact line, and for them it is difficult to get to they have problems with buses, with bus connections. So these are the overall problems of the community. Then there are pressing problems people face individually. This starts from the fourth problem, and this is the problem of crossing the line of confrontation. As I said, for the majority of the villages, their closest city is in the occupied territory, and they are still connected with these territories. Often they have relatives there and graves of their dead relatives, and they go to get some medical treatment and other services, and they cross the line of contact. And previously the road, it took them 15-20 minutes to get to the town or city. Now to cross the line, to cross all those, to undergo all those checks, it can take up to 5 hours. The next problem, this is the increased price of coal and other necessities, and the residents of Lugansk and Donetsk Oblast, they usually heat their houses with gas and coal. Now there is no access to coal, and firewood is also too expensive for them, and in order to buy firewood for winter, they should collect money throughout the year in order to buy firewood. So this is the problem they face on an individual level. Also, the issues with local government. Today, there is a decrease of revenues, local budget revenues, and local government reduce or close their programs. They only pay salaries, but in the majority of cases, even the salaries are problematic. So why these revenues to the budget reduced at the line of contact? The first region, this is state policy of Ukraine. The provision of the Cabinet of Ministers was adopted that exempt legal entities from taxes, those who are registered at this zone, and the payments they made to village councils, they do not pay them anymore, and the state didn't provide any other mechanism to cover these expenses. These could be subsidies, but at the time we carried out the survey, they didn't have this, and there is an issue of financing and addressing the needs of local communities. The other reason that caused this decrease of the budget is the reduction of production. Unfortunately, many enterprises, because of the military actions, these were agrarian enterprises mainly, they reduced their production significantly. Some of them just closed the production, and this happened because there were active military actions and also because the big part of the territory that was cultivated and used by these agrarian enterprises. These territories, they are now mined, and in some villages, the part of mined territory is 90%. So the territory that before was cultivated by agrarian enterprises, and these problems, they are the most pressing for local government and for the community on the whole and for people. And we also studied the number of issues in these villages, the issue of security, healthcare infrastructure, sources of information, and the assessment of local government and humanitarian organizations, both Ukrainian and international. And I would like to briefly tell you about this. So, concerning security, as of today, we heard this from the previous speaker, that shellings, they happen, they continue. In those 12 villages we surveyed, these shellings, they do not hit them, but they are close to the village, and this negatively influence on psychological state of people. Also about cooperation with the armed forces of Ukraine. In these villages or nearby, there are some units of the armed forces of Ukraine, and the majority of those who were surveyed, they say that there is interaction between residents and Ukrainian armed forces. There is a proactive approach from our military. They provide actively humanitarian help, food, construction materials, and they provide also medical help and to local residents, especially in those villages that do not have their own feldsher or physician. Also, the military help them in case of urgent medical need when, for example, a patient should be promptly brought to medical institution to be provided with medical assistance. About crimes in this area, the situation concerning crimes didn't deteriorate. The majority of people say that the level of criminality decreased because there are servicemen nearby who discipline local population, and also police force returned, and they didn't have it in 2014, 2015. Now police force returned and they restarted patrolling, and separate units also provide prevention measures, and people believe that if the police station is in the settlement, so people provide better assessment to the activity, or if police is not in the village or in the neighboring village. So the situation with the crimes is worse, and the assessment of people is also worse. So also there is a pressing issue of demining. This is this would provide the opportunity for economic development in this area. About healthcare, this is a problematic area. So the problems even became worse because the majority of medical workers, they left these areas, and there is no replacement for them. And there was one village. This village for 2 years remained without their feldsher because their feldsher was seized by the militants, and this person is now held in the occupied territory in captivity, and there is no resolution for this for 2 years. So about positive things. Those problems that exist that cannot be resolved by a local government, the servicemen and international organizations help to solve these problems in villages where they do not have feldsers. Doctors Without Borders, they come there weekly and help people. And also the military that are in these villages or nearby, they also actively provide medical assistance. And here I should say that we are saying that the military provide medical assistance, but these are medical doctors, and this is the message, the hint for our servicemen. In the framework of our survey, we understood that local population, even those people who are constantly in cooperation with the armed forces of Ukraine, they do not differentiate the positions, the obligations, the responsibilities in our military sector. For them, any person who is in military uniform and who are in these places, so they do not understand whether it is the doctor who provide injections or something else, or this is the civil and military cooperation groups representatives who also carry out humanitarian functions. And for local population, they see them all as military. And local population, they say that they get medical assistance from the military. About the infrastructure block, here we have positive and negative aspects. Negative, this is the bad state of roads, and this prevents quality provision of services. Roads are really bad, and in order to cover the distance from one settlement to another, it takes much more time, and the roads are damaged, and it is difficult for buses to go there, and also firefighters and ambulances. For them, this is also a problem. It takes they are in delay because of the bad roads. So what is positive about infrastructure today, due to the activity of international organizations, they continue to restore infrastructure. We had visited 12 villages, 8,000 and big ones and small ones with only several streets. And in all these settlements, humanitarian organizations work, and they actively help with construction materials, and They also they also help local population to be more active and to repair the houses that were damaged in course of shelling and to restore educational institutions, houses of culture and educational institutions. Next block in our research was connected with the sources of information. As of today, at the line of contact, the situation differs from region to region. In Bakhmut region, in those 3 villages we studied, they adopted the decision, they took decision, and they send us information to local providers to block access to Russian channels. So in Bakhmut region, local residents, the average citizen do not have access to Russian channels. They consume the information provided by Ukrainian channels. Only those who have satellite dishes, satellite TV, they have access to Russian population. But there's a small number of people. And in the Volnovakh and Mariupol region, they have simple and direct access both to Russian and Ukrainian channels. And unfortunately, we should state that in these regions where there is access to TV stations of both countries, local population consume more Russian television and they trust more Russian television than Ukrainian. And this has a number of consequences, and we also observed relation between what information products are consumed and how these people assess the situation and how it influences their attitude towards the military and the Ukrainian power. So it is not a surprise that people who consume Russian product, they trust Ukrainian forces less. But Ukrainian forces help to restore their infrastructure and help them. And people who watch Russian television, they trust less to Ukrainian power on the whole. So we believe that this point of our research, it is important for the stakeholders to think about it, and those who are responsible for information policy, they should make some conclusions out of this. And also the last one is the assessment and the level of trust to local power and humanitarian organizations, both international and Ukrainian. For us, it was interesting to see that the level of trust to local government in the prevailing majority of villages, there is high trust to local government. And only in those settlements where there are acting heads and or the heads of the settlements are often replaced, so there is less trust. But the majority of people in those settlements, they have high trust in local government. About international and Ukrainian humanitarian organizations, the most known Ukrainian organization, humanitarian organization, is Rinat Akhmetov Foundation. It carries out its activity in nearly all settlements there, and people provide positive assessment, but some residents question the intents of this fund. Some residents say that the head of the fund is that he, with one hand, he gets from people all their funds through tariffs and then provide some humanitarian help to the same people. And about international humanitarian organizations, the level of trust to them is very high, and people are grateful for their work. And we also heard about some problematic issues that we want to communicate to international organizations. First is that the majority of international humanitarian organizations, they provide help to some groups. The groups that are clearly identified, for example, pensioners 60 plus, or single mothers, disabled of the first categories. So these categories are clearly identified, and at the same time we understand that on the whole the population in those territories, they suffered, they got poorer, and they need assistance. And taking into account that humanitarian organizations are focused on these narrow groups, and these groups are targeted by all humanitarian international missions, all other population is outside the focus, and this creates social tension in frontline villages. And repeatedly we heard the opinion that population that need assistance, for example, elderly people who didn't reach pension age, but that they cannot find employment, and they also need help. Pensioners, they get pension and humanitarian help from humanitarian organizations, but people who didn't reach this age, they do not have pension, they do not have help, and they are at the point of real poverty. So medical workers and people who work in the sphere of education, they have really low salaries and they are really poor, and families with children are also vulnerable groups. So this targeting of the groups, it was useful, as our respondents say. At the beginning it was really important, but now it creates social tension, and this tension is higher than the positive effect. So this is first. And second, repeatedly we heard the opinion that today, when the issue of survival and humanitarian help, such as food packages and monetary assistance, it is less acute. Now we should change the focus and the activity of humanitarian organizations. We heard many positive responses about the programs that create employment. Several international organizations, Caritas, for example, that was mentioned a lot. So they create employment, and these are short-term contracts, and for example, to develop the settlement and to carry out some construction works, or taking care of elderly or ill people. So they hire locals to carry out these works and provide monthly payment. This is not big, this is about 2,500 hryvnias, but for people, they value this money more because this provides discipline, and they understand they are not dependents, they earn money, and also their dignity, it remains at a high level. They are not vulnerable group, they can earn, and the international organizations and the local government at the regional level and town level authorities, they should create such employment, at least short-term employment in the social sphere. So this is the recommendation of the respondents to the international organization, to shift the focus from help into providing employment. So to provide people with employment in order that they were able to carry out some work, and also uh, the activity of OSCE as of today. The work of this organization is not clear for the residents, local residents. There is subjective and objective part in this. For many locals, for them, international organizations are associated with humanitarian help, and those organizations that do not provide this humanitarian assistance, local residents cannot understand what they really do, and the representatives of OSCE, they should provide proper communication and explain their mission at the line of contact and in frontline area. So that's all from me. Maybe if you have questions, I would like. If you have questions, please ask. Anna Galaktionova, International Medical Corps. We are international humanitarian organization that support population in the territories you've mentioned. We studied the situation. So you've mentioned MSF Caritas. So really, our respondents, these were activists, those people who help to distribute humanitarian assistance. Our respondents mentioned a lot of organizations. I do not remember whether we put them in our report. These are UNICEF, Doctors Without Borders, the Red Cross, some religious organizations, the Foundation of the Pope, the International Organization for Migration, Ukrainian Akhmetov Foundation, Shoulder to Shoulder, East and West Together. They provide recreation for children in the summer. And so one more question. In the international humanitarian community, there is a sharp issue of coordination to cut the basic needs and to involve population in the study of these problems, and we should understand who does what and how it is perceived by local population, and whether people understand this clearly. And briefly speaking, about half of our respondents, these are people who are active, they are volunteers, and they all know about the international organizations, the list of these organizations, and the level of trust is high. The assessment of the activity is positive, and we may apply to these points that I've mentioned in my speech. So the majority who have, so international organizations who have some level of bureaucracy, religious organizations, they have less bureaucracy, and they can distribute help more evenly and to use this help to restore infrastructure, and also that narrow groups are targeted and other groups are not targeted, and they are in need. This creates social tension. And second, it is important today to shift the focus and to provide not fish to people, but a net. And maybe you've mentioned it at the beginning. How can when and how we can get the full report? So it is printed. My colleague, Mr. Bogdanovich, he can provide this report to you. If you have some questions about some points of our report, we can have a meeting and we will provide sampling at your request. About English version, yes, we plan this next we will have it next week, but this will be the holidays. We will publish this report on the site, but you can get it on request. It will be quicker. Thank you. Do you have other questions?
If you have questions in English, you can also ask me. I'll understand. No questions. Okay. В такому разі дуже
So, thank you very much. Thank you for your time. Thank you for what you do for the Donetsk and Lugansk oblasts and for Ukraine. Have a nice day.